Hi, I'm Sue Anderson, President and CEO of the Dignity Health Hospitals on the Central Coast.
And I'm Montisa Phelan-Lopez. I'm the Vice President of Philanthropy at Arroyo Grande Community Hospital. Sue, one question that we do get asked is, why are the hospital bills so high?
Right, by law, we're required to bill everyone the same amount. But in truth, we get about 22% of what is charged on a bill. Every insurance company and Medicare, Medicaid pay different amounts to hospitals. There's contracts with hospitals, or in the case of Medicare and Medicaid, it's set by federal law. So we get reimbursed a fraction of what are on those bills. And therefore, most hospitals' profit margins are between 1% and 4%. It's a very small margin business. And that's why community support is so important, to help us really have state-of-the-art equipment and services.
Right. If we had to wait to purchase these items or upgrade our technologies through regular hospital operations, we wouldn't see some of these advances for years. And those things are needed now. Our community, our families, they need those services and the very best healthcare today. A lot of people don't realize that we are actually a nonprofit hospital.
Yes, Montisa, as a faith-based, mission-driven nonprofit, we really are here to take care of our community, but we need the community's support to do that. Any income that we make gets put right back into the hospital, into our capital funds. We reinvest it in the community. We also are required to provide community benefits that are equal or above anything we would pay in taxes. So we do that. We are active in our community, helping on homeless projects, helping on Mixteco populations, providing interpreters. Through philanthropy efforts, we've been able to add transport to treatment for cancer patients. We've been able to add nurse navigators to our cancer program to help patients through their journeys. We have a cancer rehab center where patients can take classes, all of that without charge to anyone. So the community support is really important for a lot of our programs and services too.
The other thing that I think is really important for the community to understand is that we have an operating grant from Common Spirit, which means that every dollar that's donated goes directly to where the donor designates. So there's no overhead costs taken out of donations. And truly, every gift, large and small, are so important to us and make such a difference. It truly takes a village, and in this case, the entire community.
Arroyo Grande Community Hospital is truly a community hospital. And if you think about it, without our donors, we wouldn't have been able to expand the emergency department the way we did, and thankfully it opened right during the pandemic, which was really needed. And today, the emergency department at Arroyo Grande Hospital is busier than any other emergency department in the county. So we put that new emergency department to very good use. Additionally, in the last couple of years, we've done a lot of work in our operating rooms to improve all the equipment there with lights. We've also opened a crisis mental health center in Santa Maria, but it's used by all of our hospitals. All of those things would not have been possible without community donations and support. And Montisa, why don't you tell us a little bit about the Excellence Campaign?
Oh, thank you, Sue. So the Excellence Campaign is underway. We are almost halfway to our $7.5 million goal, which is incredible. And over the past couple of years, we've been able to provide advanced imaging for the hospital, including 3D mammography and biopsy equipment, which in the first year that technology was in place, over 80 cases of early stage breast cancer was diagnosed. We've also been able to provide mobile digital x-ray, which brings the x-ray directly to the patient. So if you come into our emergency department with, let's say, a broken arm, you don't have to worry about being moved around and the discomfort of that. That x-ray technician is going to come directly to your bed and take that x-ray. In the future, we have some really exciting things planned for the Excellence Campaign as well. We are currently focused on radiology and fluoroscopy. We're going to be creating a brand new suite, which is going to be really so helpful for this hospital. We currently transfer about 10 cases per month that we are unable to fulfill their imaging needs. So in the future, that won't be necessary. Our inpatients, our emergency department patients will be able to stay here and be treated in our hospital. Additionally, we will be bringing a new MRI to the hospital. We hope to bring it in-house, which would be really incredible to get it out of our trailer. And also private patient rooms, which I think everyone is excited for private patient rooms, because who wants to share a room with someone, and especially when you're sick or you're recovering from surgery. It's going to really help provide that healing environment, the ability to have your family in the space with you while you're recovering, and share really important information with your doctors without feeling like your neighbor is overhearing everything that you're saying.
Right, the hospital currently is investing in the future with an investment in an acute rehab hospital that we hope will be built very near the hospital. And then at that time, we'll be able to get started on some private patient rooms at Arroyo Grande Community Hospital.
Yes, Sue, we're really excited about the future. We have so many plans for this hospital, and we couldn't do it without our community. We are so grateful for every gift, whether large or small. And also, we hope that people will think about the future and how maybe they can leave the hospital in their estate or wills. Also, talking to your tax professionals about how you can make a gift that will benefit yourself and the hospital.
Montisa, I really want to thank you and your team for all their efforts to bring so much to the Arroyo Grande community. And you know, our foundation board, they do a tremendous job at really getting the word out. But as a final word, what would you like to say to the community?
Every dollar that we raise through the Arroyo Grande Community Hospital Foundation stays locally and supports our hospital. If you are interested in making a gift to the foundation to support our hospital, you can do that through our website at supportarroyogrande.org.